and welcome to episode 8 of the SaferF Stories podcast. I'm Jill Ramsay-Stewart, network leader with the Integrated Access and Flow Network and SaferF Provincial Liege. In this episode, I'm chatting with Carolyn Smith, quality improvement and safety leader with Central Zone, with quality improvement and safety at Nova Scotia Health. Before we get into our conversation, I'd like to give you a little bit of Carolyn's background. Carolyn has worked as a community health nurse in a remote flying community in the Northwest Territories and as a public health nurse in Yellowknife on the communicable disease team. As a senior nurse consultant in oral health for the Department of Health and Social Services, Carolyn worked to improve oral health services across the territory. When she was the quality assurance and risk manager in the Northwest Territories, Carolyn led accreditation, worked on policy development, and developed patient safety improvements. After 17 years in the Northwest Territories, Carolyn returned home to Nova Scotia in March of 2022 and joined Nova Scotia Health as a public health manager for the COVID response team. Joining the quality improvement and patient safety team in Central Zone in June of 2023, Carolyn has worked with the Phase 2 of SaferF unit and the daily management system, and looks forward to working with the teams in Phase 3, combining these two initiatives. Carolyn, welcome, and thank you for joining me on the SaferF podcast stories.
Thanks for having me, Jill.
So I'll get started with my questions. So can you tell us a bit about your role as a quality improvement and patient safety leader with SaferF? For those who aren't familiar, can you describe what that role is?
Yeah, sure. First, I'll just describe a little bit about what quality improvement patient safety leaders in the Central Zone kind of do overall. Everyone on our team has a role in patient safety. So teams will see us in things like quality reviews, such as a quarterly quality pressure injury review. We also lead accreditation. So that's helping teams prepare for the accreditation cycle, providing those ROP 1-pagers, and helping teams with their mock tracers. Many teams in the Central Zone would have had an environmental walkabout this summer and feedback provided, so that would have been arranged by our team. And we also do quality improvement coaching, and that's how we're involved with SaferF and DMS. We work with teams to understand their problem and what they are looking at. So we help them develop their change ideas and implement those time-bounded tests of change, and really helping teams to build their quality improvement knowledge and capacity.
Thanks. How do you work with and help the participating SaferF units?
Yeah, so SaferF is a somewhat different approach than, say, what teams would experience in the Quality Collaborative, because we are already starting from a place where we know what the problem is. We know patients are waiting too long in hospital, and through the SaferF bundle, teams are really trying to reduce those risks associated with prolonged hospital stay. So things like decreased mobility and increased frailty. Teams are also trying to reduce those bottlenecks and that unnecessary waiting time. So what that means as far as the quality support goes is that because we've already been through a couple of phases of SaferF, we kind of already know what works well for teams and for patients and families. So while we don't have a blueprint, quality coaches can really help team. We already know kind of what the change ideas are, so we can bring those to the teams and kind of help the teams make those change ideas work to for their team specifically to implement the bundle.
Sure, thanks. And that sort of leads me to my next question. Having already gone through Phase 2 of SaferF, what are some of the learnings you've experienced with the units? And is there anything you would do differently or have the units do differently as we were moving into Phase 3?
Yeah, so learning from Phase 2, health service managers cannot do this work alone. They really need support from their teams. The more people on the team that can help support the work, the better that will be for sustainability over time. So that would be something that would be a really important piece of learning for me. What I would do differently or advise current teams now is to really engage and understand their data early. So that is looking at their Tableau page that's available and getting familiar with what that SaferF Tableau page looks like and what that data can tell us.
Great pieces of advice. I know it's early days, but with the integration of the daily management system, also known as the DMS, how is it affecting the work that the participating SaferF units are doing?
Yeah, yeah, like this wave is different than previous SaferF waves because of the DMS, or the daily management system, has been integrated or added into the learning for teams. So teams that haven't heard of it yet, or if you haven't heard about it yet, the DMS is one of those building blocks of operational excellence. The DMS is a set of behaviors and tools and techniques that can sustain change ideas over time by providing us that structure and processes. So kind of what I mean by this is that the tools of the DMS can help drive the change. In this case, a SaferF bundle. Having the DMS in place for these SaferF teams will help the team sustain the SaferF bundle over time, and it will also help them with future quality improvement initiatives as well.
Okay, great. It's good to hear that there's tools out there that are going to help with the sustainability, because with all the initiatives happening, sustainability is a challenge for sure. But it's good to hear that the DMS will help to support that. And so my final question is, any words of advice for units learning about SaferF and DMS? Anything else you'd like to add?
Yeah, I guess something that I would add for advice would be really to shrink the change. Many teams will see the bundle and want to implement bullet rounds and look at frailty and get their discharges before noon and do all of the things all at once. And I would really advise to slow it down, look at one change idea at a time, and break that idea down even further so it doesn't seem so overwhelming. Small, easy goals help to build confidence on the team and momentum on the team. So really, the more you can shrink that down, the more that will help with this uptake by the team, and then that sustainability over time.
Yeah, great words of advice. Carolyn, thanks so much for taking the time to discuss your work with SaferF and DMS. I've had the
Thanks.
pleasure today to speak with Carolyn Smith, Quality Improvement and Patient Safety Leader, about her work with SaferF and DMS. This has been episode 8 of the SaferF Stories podcast. Please like and subscribe to the SaferF YouTube channel to catch upcoming episodes. Thanks for listening.